One of the sessions I found very interesting this morning was on the therapeutic symposium. This was the Monday morning session, and the focus was on antibody-drug conjugates. And I think this is a really interesting area because it's one of the new therapies we've been hearing a lot about over the past couple of years. And one question, I think, is, are these drugs showing the promise that we hope they will? What are the challenges, and where is the way forward? So one of the things we heard was probably slightly disappointing data in the past couple of years, where a number of studies have shown some activity of these drugs, sacituzumab, datopotamab, for example. But I think that activity has been modest. There might be a subgroup who's benefiting, but we don't quite know who that subgroup is. And one of the things we learnt about in the symposium today was, if we're going to try to understand why ADCs work and why ADCs don't work, you have to look at the whole package. You have to look at the structure of the ADC, the antibody part, the linker, the toxic payload. You have to look how that will be internalized by the cell. You have to look how that's processed by the cell. You have to look at how resistance mechanisms to chemotherapy may develop. And it's only by looking at all of those that you could perhaps look at the whole activity of the drug. And then the third talk in this excellent session was about biomarkers and trying to pick out patients in whom these drugs will work the best. It looks like immunohistochemistry is not going to be the way forward. It's probably quite limited. You could just give it to every patient, but that may not be the way forward. It's a bit of a blunt tool. And perhaps the way we might see is more bespoke biomarkers coming through to allow us to identify patients. So I think all these are needed for us to understand whether these drugs are going to be effective. But ultimately, they are chemotherapy delivery approaches. And my concern remains that unless we're able to get this drug more accurately targeted, the toxicity will outweigh the benefit.